first thing we're going to do today is a wound assessment. You're going to start with the wound bed color. This can be black, meaning that there is full thickness tissue death, yellow, meaning that there's death of the muscle and subcutaneous fat, red, meaning that there's good vasculature and that the wound is healing, and green, meaning that there's infection or gangrene. Then going to want to look at the edges. So you have approximated edges, which means that they are closed with staples or stitches. You're going to have unapproximated edges, which means that they are open, and then you're going to have rolled edges, meaning that the skin has rolled under the epidermis. You're then going to want to look for characteristics. So you have edge scar, which is yellow or black, meaning necrosis. You have granulation, which is red, pink, and bumpy, meaning that the tissue is healing. You're then going to have drainage-wise, it's either going to be moist or dry. You're going to look for tunneling, and you're also going to, which are little holes that extend deeper into the wound, and you're also going to look for undermining, which means that the wound extends beyond the wound edges. And then you're going to look for drainage. So you have serous, which is a clear liquid. You're going to have serosanguinous, which is a pink or yellowish liquid. You're going to have sanguinous, which is bloody, and then you're going to have purulent, which is like a yellow or green pus. So the first thing that we're going to want to do when assessing our wound is to educate our patient about what we're going to do. Going to want to make sure that the bed is at the appropriate level, both for you and the patient, and you're going to want to remove any type of pre-existing dressing. So you're first going to start with hand hygiene. You're going to apply sterile gloves. And you're going to want to make sure that you have your supplies. So you need your tape measure and your cotton applicators. So the first thing I'm going to do is I'm going to assess the wound. So I'm going to look at the wound color. So the wound color is red, meaning that there is good vasculature and that there is tissue that is growing. In terms of edges, there is some approximation, meaning that it's closed, and some that's unapproximated, meaning that it's open. In terms of characteristics, I don't see any black or any drainage as of right now, but I do see some tunneling and possible undermining. So what I'm going to do is I'm going to take my cotton applicator, going to insert it into the deepest part of the wound, just here. I would then take it out, mark it with my glove, and I would measure it to see how far it is. I would then dispose of this. I would then take this and I am going to measure the wound. So the wound is about 4.5 inches in length and about 1.5 inches in the larger part of this wound, and then the rest is about 1.25 inches. I then am going to take a new cotton applicator, and you're going to want to use a new cotton applicator in every new location that you suspect any tunneling or undermining. So in this area, I can see some undermining, meaning that the wound is extending beyond the wound edge. And I also see some slight tunneling, and same with over here. So then I would discard my applicator. I would remove my gloves. I would perform hand hygiene. And then I would talk about wound care. So at this point, I would probably do some sterile draining of the wound, and then I would apply a new sterile dressing. I then would make sure to educate my patient about the status of their wound and how their wound looks for this assessment versus their last assessment.